Okay, welcome to Chapter 19. This is Small Animal Medical Nursing. This is a brief interview or introduction into small animal medical nursing. We're going to do a lot more of this if and when you get into the program, but these are important things to remember, not only for the test, but these are things that even if you go into just doing veterinary assisting or reception work at a veterinary hospital, certain things that you're going to need to remember. You're going to remember some key terms, reasons why we're doing this for the animals, why veterinary technicians are really important in this type of practice model. We're going to talk about etiology. What is the etiology? How diseases begin. Pathogenesis, how diseases progress. Lesions are what we see, the symptoms of the diseases, and then the clinical signs as well. We're going to talk about respiratory disease, cardiovascular disease, digestive, hepatobiliary, which is liver disease, urinary, endocrine, immune-mediated, a lot of different diseases. We're going to just go quickly over. We will have a separate class that goes along with our comparative anatomy and physiology, talking about the diseases in more detail. So why do we do this? There are 5 freedoms that we want for animals. Freedom from hunger and thirst, freedom from discomfort, freedom from pain, injury, and disease, freedom to express normal behavior, and freedom from fear and distress. So really working and being an advocate for animals means that you want these 5 freedoms for them. What is a veterinary technician practice model? It's a cyclical nursing process, and it's the best way of making sure that we're continuing to provide the best care for patients throughout their time with us. Step 1 is gathering patient data. So first of all, in order to make a good decision about what is going on with a patient and what we need to do in order to make the patient feel better, we need to get data. And we've talked about different ways that we get samples from patients, blood, urine, feces, doing a physical exam, those kind of things. And that's all data. Remember, that's objective material that we can use to make decisions. Then we want to identify and prioritize what our This is the next chapter 3 is when we introduced technician evaluations. Chapter 19 is where we go into a little bit more what those. I remember as a technician, as a veterinary technician, you are a paraprofessional, you are a professional, and so we value in the veterinary medical profession, we value your opinion. In order for us to really be able to value your opinion and know that you know what you're talking about, there are certain evaluations and assessments that is absolutely appropriate for you to make, and you should be making these assessments in these ways. And there's a list in your book, and then there's also another table that identifies what those assessments and evaluations mean. And I really, really, really need you to go through those lists and to understand. So for instance, anorexia means the animal is not eating. If you put an assessment that this pet is anorectic, that means something to somebody who is trying to evaluate this pet. So it's really important that you put your evaluations in there. You have eyes in your head, you've got a brain in your head, you've got nose and ears, and you're using your observations to make these evaluations. You've been educated to make these evaluations. If you use these evaluations correctly, then people can trust your observations and your evaluations. So I hope that makes sense, but really I want you to pay attention to those lists of the appropriate words to use when you're making assessments. Once you've made an evaluation and assessment and have discussed this with your doctor, it's always important to get more than one brain working on a problem. We want to develop a nursing care plan. The nursing care plan is what we're going to do to make that pet free from disease, free from hunger, thirst, free from discomfort, free from pain. So that's what our nursing care plan is going to be. Sometimes it's going to need to involve the doctor if you're going to need to do a prescription, if you're going to need to do a diagnosis in order to get to the next step in your plan, if you're going to need to do surgery. Sometimes it's just about being a good nurse, and we'll talk about what that means. Then we want to reevaluate. You always want to go back and gather more data. Is what you're doing working? If it's not working, what do we need to do in order to improve the outcomes? So we want to make sure that you understand each part of this cyclical nursing process, and that we always have to go back and reevaluate what we're doing, reevaluate that patient. So step one, we're going to start with a medical history from the owner. We've talked about this before. This was in Intro to Vet Tech 1. How do you get a history? You want to start by asking open-ended questions. You're going to put the data in the patient chart. Remember, if it's not in the medical record, it hasn't happened. So we want to make sure that whatever data you're gathering now goes in the patient chart, and that you look back for historical information so that you understand what's gone on with this patient in the past. You would do a physical exam. Yes, you as a veterinary technician should be comfortable doing a physical examination on a pet, from tip of the nose to the tip of the tail. You should be able to recognize what looks abnormal. Laboratory results, so diagnostic, surgical, medical reports, all of these things go in the data, the objective portion of our notes, and then we want to consult with the attending veterinarian with any questions about the case that's not mentioned in the medical record. Again, should all be in the medical record, but if it's not, we want to talk about it. Step 2, identify and prioritize your technician evaluations. This is your clinical judgment of the patient's needs. As an educated professional, you should be able to make an independent critical analysis of the gathered data. We want you to be a critical thinker. We want you to use all of your education, everything you've learned, in order to make a good clinical judgment, an educated judgment of what's going on with a patient, and then work together with a veterinarian to come up with a plan to treat the problems. So there are 3 broad evaluation categories. So we have identification of what the actual problems are, and this is really where a lot of the words come in. So if they're anorectic, means they're not eating. If they are have abnormal eating behavior, so they're sort of eating but not really eating, that's an actual problem. There's also a risk of future problems. So another evaluation would be risk of infection. And then also client knowledge. Remember, it's your job as a veterinary technician to make sure that your clients are educated. That's one of the primary jobs of the veterinary technician. So that's another evaluation category that we have. What is the level of client knowledge and or their coping abilities that's going to help or impair the at-home care of the pet? And then we need to prioritize this. How important are these evaluations, this assessment to the quality of the life of the patient? So if they're having difficulty breathing, that is a high priority. If there's a client knowledge deficit, we can deal with that later. Let's work on the problem with the breathing first. So just that's kind of how we think through these evaluation and assessments. Step 3 is develop nursing care plan. We want to establish desired outcomes. We want to identify interventions for each outcome. An intervention is a treatment that we might do. And then we want to create a nursing care plan. The entire list of interventions are specific to the patient, okay? And we do have some listed in Chapter 19. There are some lists of the interventions that a technician is permitted to do with or without the added veterinarian assistance or supervision. So there are a lot of things that you can do as a technician for which you don't need to ask permission for, just to make that pet feel better, because you are educated and you know what you're supposed to be doing in order to create a more comfortable environment for this pet. One of these things might be turning the pet. So if they've been lying in the same position for a long period of time, putting soft towels under the pet, turning the pet so that they don't have any areas of their skin that have decreased blood flow to them, creating ulcers. Those are nursing care things that you should be thinking about doing as you're taking care of a pet. Step 4 is reevaluating the patient. So we want to gather more data. We may need to get some more blood tests to see if we are, for instance, if we have anemia, are we making more red blood cells? Are we not making more red blood cells? Is it time to do a blood transfusion? If we are having issues with the kidneys, do we need to give them more fluids? Do we need to change the electrolytes that are in their fluids? So there's a lot of different things we want to look at. We're going to reassess the patient, so we're going to do another physical exam. We may make new technician evaluations, and then we're going to do a plan of care that's adjusted to include that new intervention, the new data with the new interventions. All of this is going to go in the medical record so that it has actually occurred and happened. All right, so we're going to talk about diseases. So anything that we do in a veterinary practice is typically related to either preventing diseases, which is our preferred way of dealing with diseases, or treating animal diseases. So we need to think about the overall disease process. So it starts with etiology, which is the study of causation or origination of the disease. One of the etiologies that could occur is something called idiopathic. So if we can't figure out where this disease came from, the cause of the disease is unknown, we call that idiopathic. And one way to remember this word is that we're idiots for not understanding the pathology. This doesn't happen very often, but let me give you an example of one type of idiopathic disease. Idiopathic epilepsy is something that can happen in you see it in certain lines or breeds of dogs, where for some reason in their brain there's a cluster of cells that doesn't communicate properly. We don't know why it happens. It's probably a genetic thing, but we call this idiopathic. It usually occurs, we start to see seizures occurring at 2 to 3 years of age, and they will continue until the animal dies of either seizures or something else. We can control those seizures with medication, but we don't know why they happen. So sometimes when you don't know the cause of the disease, it makes it hard to cure the disease. So we don't like to use the word idiopathic because it makes us sound like we don't know what we're doing. But there are times when diseases occur and we don't know what's causing them. Pathogenesis is the mechanism for the development of the disease. A disease can be acute, meaning it's happening very quickly, or it can be chronic, which means it happens over time. And clinical signs will be different based on whether it's an acute disease or a chronic disease. Clinical signs are identifiable body response to pathologic events. Not all patients with the disease will show outward signs of illness. So how many of you maybe have a cat all of a sudden seems really, really sick? A lot of times they've been sick for a long time, but haven't shown any outward signs of illness. And the reason is, for most animals, when they show signs of illness, they become prey. And so it's instinctual for animals to hide, so many animals to hide signs of disease. Cats are really good, particularly good at that, and so we don't usually find out that they're sick until they're really, really sick. Dogs are not necessarily as good at that. They've been domesticated for a lot longer and are comfortable within their environment. There are some dogs that are better at that than others. There's certainly some breeds that don't tend to be as good at hiding their discomfort as others. We joke about beagles because beagles are known to be kind of crybabies. They tend to show their pain pretty easily. Huskies as well. They tell you when they're in pain. But there are other breeds. Labradors tend to be very stoic, for instance, and you don't know that they're hurting until they're really hurting. All right, so let's go through the systems. Respiratory disease. All respiratory disease tends to have some similar symptoms. And so when we talk about respiratory disease, a lot of times we have to really search for what is actually causing the respiratory disease. So often we see nasal discharge, congestion, sneezing, stridor, which is a high-pitched inspiratory wheeze. That means when you breathe in, you make a really high-pitched noise. That's called stridor. Cough or hemoptysis means coughing up. Hemoptysis is coughing up blood. Pleural effusion. The pleura is the lining of the thoracic cavity. It's outside of the lungs. So pleural effusion is the accumulation of excessive fluid in the thoracic cavity outside of the lungs. And when you have too much effusion or fluid outside the lungs, they can compress and collapse the lungs. Dyspnea is difficulty breathing, respiratory distress. Orthopnea means that they have difficulty breathing in a certain position, typically lying down. Hypoxia is deficient tissue oxygenation, and hypoxemia means a decrease in arterial oxygen partial pressure. So when we have decreased tissue oxygenation, you should know that the tissues aren't pink anymore, right? So oxygen combined with hemoglobin makes the tissues red. When we lose oxygen, now we have cyanosis. That's a cyanosis, and that is when the tissues turn blue. And that's a sign that we're having some pretty severe respiratory disease. So any respiratory disease, so there's upper respiratory disease, which is where we have a lot of nasal congestion. It's anything from the trachea, basically the upper trachea up in the mouth and the nose area. That's upper respiratory disease. Lower respiratory disease is anything in the chest. So there are two types of respiratory disease, and we try to distinguish between the two because we have some different treatment things that we do. But there are some common treatments that we do for every respiratory disease. First of all, humidifying the air. Airway humidification, hydration helps the animal to move this mucousy material out of their system. Coughing is a normal way to clear the respiratory disease. It's the body's mechanism of clearing the trachea and the respiratory system anatomy of bad things, bacteria, fungus, etc. So if we can make it easier for that respiratory system to clear it by humidifying or watering down the secretions, that can be helpful. If we have dyspnea, we may have to intubate or put a tube into the trachea of the animal. If they are sedated or unconscious, that's easy. Otherwise, we may have to do a surgical correction procedure where we're actually opening up in the throat to the trachea, directly to the trachea. Oxygen therapy is pretty common for respiratory disease, especially if they become cyanotic. Coupage and positioning strategy. So how do they breathe better? If they're lying on their side and they're having trouble breathing, we want to position them upright. Coupage is a way of cup your hands and banging on the sides of the animal. It helps to break up the mucus in the chest and break up the fluid and allow the animal to cough that out. Drainage procedure. So if we have fluid around the lungs, we can place a catheter into the thoracic cavity and drain fluid, whether it be blood or lymphatic fluid, that space, and allow the lungs to expand. Medical therapies, so medicines that open up the bronchioles, antibiotics, antifungals. We have to do some diagnostics in order to find out what medical therapies are going to work best. And then sometimes we have to do chest tubes, and if we put chest tubes in, they can be painful. So analgesia means to use something to reduce the pain. So that's respiratory disease. One other thing I want to say about respiratory disease. A quick way to diagnose whether something is an upper airway versus lower airway disease with respiratory disease. If the animal is having trouble, or person, having trouble breathing in inspiration, or you're hearing sounds on inspiration, that means we have an upper respiratory disease. If the animal is having trouble breathing out, that's an expiratory disease or a lower airway disease. So if you think about it, breathing in, it's easier to fill the lungs. So if they're having trouble breathing in, that means we have kind of a blockage in the upper respiratory area. It's actually harder to get stuff out of the lungs when you have diseased lungs. So when animals are having, or you're hearing loud sounds when they're trying to breathe out, that's a lower airway disease. So that'll be in the lungs. And it's important because choosing the right medical treatment, using one thing to treat an upper respiratory disease may cause a lower respiratory disease to become worse. And so we have to be really careful. So I want you to think about, use your critical thinking now, what are some ways that we can diagnose whether we have an upper respiratory, simply just an upper respiratory disease versus a lower respiratory disease. And we'll talk about this in class, but I want you to think about some ways that you might diagnose that. All right, cardiovascular disease or heart disease. There are two basic types of heart disease, things that affect the heart, and then there are diseases of vessels as well. Myocardial disease is a disease of the myocardium, which is the muscle of the heart walls, the pump. 80% of heart cases in cats are myocardial disease. With dogs, 75% of the heart cases in dogs are due to valvular diseases. So the heart is a muscle that pumps blood in a certain direction through these valves, which are doors. And if these doors are not closing correctly, then the blood won't pump efficiently through the heart. So it will go in the wrong direction. It will build up in the heart and will cause more problems. So mostly dogs have valvular disease, and most dogs with valvular disease have a mitral valve problem. The mitral valve is in the left side of the heart, and it's the first valve that blood comes into contact as it comes through the lungs. And the most common cause for mitral valve disease, which is the most common cause of heart problems in dogs, is a nasty mouth. So dental disease leads to heart disease in dogs. Dental disease in cats, for whatever reason, tends to lead toward renal disease. So it is really important that we keep those mouths clean. Some common symptoms of cardiovascular disease is tachycardia, so increased heart rate. Tachycardia, increased heart rate. Abnormal femoral pulses, murmurs, which is an abnormal heart sound, and arrhythmias, which is an abnormal rhythm of the heart. How do you feel femoral pulses? If you remember back to Intro to Vet Tech 1, how'd you stick your hand around the thigh of your animal? In the middle of the thigh, you should feel a femoral pulse. If it is not pulsing at the same rate as the heart, that's abnormal. Diagnosis. So we basically need to image or see the heart to help diagnose it. We can use electrocardiography because the heart relies on electrical impulses to move the muscles in a coordinated rhythm to move the blood efficiently through the heart. So we can follow those electrical pulses and understand how the heart is functioning. Cardiac biomarkers, when the cardiac tissue starts to die, it releases enzymes into the bloodstream. And if we take blood looking for those enzymes, we can understand if the heart tissue is dying. And that can be really helpful, especially for diagnosing early heart disease in cats. Echocardiography is using an ultrasound to actually look at the heart beating. And if we're using it correctly, we can also use it with a color Doppler to see how the blood is flowing through the heart as well. A lot of times, heart disease can be asymptomatic. They can live with heart disease for a long period of time without us seeing anything. So we kind of want to just monitor for tachypnea, which is increase in respiratory rate. Tachycardia, increased heart rate. Tachypnea, increased breathing. Eventually, so the animal will be asymptomatic for a long time because the body will compensate for the heart not functioning really well. It'll open up blood vessels. It'll try to increase tissue perfusion, whatever way. The animal may just become a little bit less active, but owners may not recognize these things quite as quickly as we would hope. Eventually, cardiovascular disease is progressive. No matter what we do, we can prolong their life for 4 to 6 to 8 years, as long as we possibly can with medication, but eventually the pump will fail. The compensatory mechanisms fail, and the heart muscles will fail. Heart failure itself is when we have inadequate tissue perfusion in prolonged heart disease. So the heart muscle just gets really tired and we can't get blood with oxygen to the tissues. So some signs that we will see are tachypnea, so increased respiratory rate. Syncope is interesting. It is when the brain does not receive enough oxygen and the animal faints. So syncope is a word that you're going to have to remember. A lot of people confuse seizures with syncope. Syncope is just fainting, whereas seizures is fainting with neurologic kind of fainting, but increased neurologic activity. So they'll be paddling. They may lose their control of their bladder, their rectum, have feces, they may froth at the mouth. It's a little bit more active than fainting. We also may see weakness, a prolonged CRT, which is capillary refill time, pale mucous membranes, exercise intolerance, often in cat, anorexia, depression, and weight loss in cats. Cats tend to vomit with heart failure or heart disease. And that's a really interesting, it's not in this lecture, but it's a really interesting fact that you have to remember with cats, that if they are vomiting, heart disease is one of the things that we need to look at. Treatment would be, and we'll go over treatments in medical treatments in more detail, but if you know anybody, any human or animal that has heart disease, you know they're on a number of different drugs. And the reason is that the body has a lot of ways to compensate for a poor failing heart, and so we need to compensate for the compensation. So we have a lot of different drugs that will help with a lot of different areas. So ACE inhibitors, don't worry about that. We'll talk about what that means later. Beta block, but remember ACE inhibitors, because that word's going to come back to you about a year from now. Beta blockers, which blocks the beta receptors for the sympathetic nervous system. Positive inotropes. Positive inotropes mean they help the heart muscle to contract better. Calcium channel blockers. The heart muscle needs calcium in order to beat effectively, and if we block it, sometimes we can allow the heart to expand and gather more blood before it beats the next time. It can be a little complicated, but understand that there are a lot of different things we use. Those are all to help with the heart, and then to help with there are also antiarrhythmic drugs to keep the heart beating at a certain pace, and then antihypertensives to help with blood vessels, low sodium diet, stress reduction, and exercise restrictions. So a lot of different things we use for heart failure. When we get to congestive heart failure, this happens because when the pump fails, then fluids back up. And depending on which side of the pump fails, which is it the left side or the right side, is where the fluid will build up behind it. So decreased cardiac output means decreased blood flow through the heart and out of the heart. And when we have decreased blood through the heart and out of the heart, we have tissue hypoxia. So tissue hypoxia means we have decreased oxygen to the tissues, which damages and kills the tissues. So this causes a poor venous return and fluid overload, which means if the pump is not pumping, then you're going to get a traffic jam behind the pump. If you, for instance, if you think about this in terms of traffic jams, if you have a toll booth and there are a lot of cars behind the toll booth because the toll booth is not functioning properly, you're going to get a backup directly behind that toll booth. If it's on the left side of the road, that's going to be left-sided congestive heart failure. If it's on the right side of the road, it's going to be right-sided congestive heart failure. So it depends on which side you're going, and that's where things will back up. So if you have left-sided congestive heart failure, you have to think about how fluid is going into that side, and basically fluid will back up into the lungs, and we call that pulmonary edema. And in cats, it actually backs them into the pleural space, which we call pleural effusion. So in dogs, it backs up into the lungs, so you get a lot of fluid in the lungs, spongy lungs. In cats, it will compress the lungs because it backs up into around the lungs. So what will you see with left-sided congestive heart failure? Lung signs, dyspnea, abnormal respiratory signs. You'll hear crackles, wheezes, decreased lung sounds with the fluid in the chest. With right-sided congestive heart failure, the blood is coming into the right side from the body. It's the venous return from the head, the jugular, and the abdomen. So we get congestion into the abdominal and thoracic cavities. We get edema, jugular distension, abdominal distension due to ascites. Ascites is fluid buildup in the abdomen. Hepatomegaly, so fluid will build up in the abdomen, but also into the liver itself. And then pleural and pericardial effusions as well. So it'll back up anywhere that blood is supposed to return back to the heart from, which is all the tissues. Treatments for CHF, once they're in congestive heart failure, we're kind of just trying to keep them comfortable. So giving them oxygen, giving them diuretics, which are things that remove fluid from the body. And the most common one is Lasix, or it's also called furosemide, and the removal of any effusion. So if we have to stick a needle in some place, the abdomen or into the chest, to physically remove fluid, that can give them a little bit of time. Not a lot of time, but a little bit of time. So I have this pictogram here for you, giving you an idea of what left-sided failure versus right-sided failure will look like. Cats are more likely to get left-sided failure because what they get is a hypertrophic cardiomyopathy. Remember, cats are more likely to get cardiomyopathy, and hypertrophic cardiomyopathy means that the heart walls grow bigger than normal size. And so when the heart walls get really, really thick, that means there's not enough space for the blood to accumulate and pump out. So we have a decreased cardiac output. We have an abnormally thick heart wall. Very common in cats. And remember, when you see cats with heart failure, it's typically hypertrophic cardiomyopathy. It's typically a myocardial dysfunction, so muscle of the heart dysfunction, and a lot of times their only sign will be they will vomit. So that's something that we have to think, or that the sudden death, and we see this fairly often in cats. Right-sided heart failure we see more often in dogs, and a lot of times it's due to mitral valve insufficiency. So they have dental disease leading to infection of the mitral valve, which causes the mitral valve not to close as well, which causes backup it actually causes backup in the left side, and then it causes failure of the right side, and then we have ascites. So disease of the heart muscle, the primary cardiomyopathy, hypertrophic cardiomyopathy, is most common form in cats, whereas dilated cardiomyopathy is the most common form in dogs. Dilated means we have an increase in the size of the heart. The heart muscle gets thinner than usual, and the heart gets bigger than usual. There is also an arrhythmic right ventricular cardiomyopathy, also known as boxer cardiomyopathy because it's common in boxers. Secondary cardiomyopathies caused by underlying disease process. Sometimes like feline hyperthyroidism, which is a disease of the thyroid gland, or dilated cardiomyopathy, which is secondary to a canine parvovirus infection, can cause a secondary cardiomyopathy. Treatments for hypertrophic cardiomyopathy, there's not a whole lot we can do for cats. We have to try to prevent them from getting what we call thromboemboli, which are blood clots. And they get blood clots because the blood isn't pumped well through the heart, so it just kind of sits there. And we know that anytime blood sits, it tends to clot. So we treat blood clots by giving them a half a baby aspirin every 3 days. So hypertrophic cardiomyopathy, not a lot of treatment for it once they have it. Hard to diagnose, hard to treat. Dilated cardiomyopathy for dogs, we're going to use diuretics, ACE inhibitors, and positive inotropes to try to get that heart to beat a little bit better. Degenerative atrioventricular valve disease. So this is most commonly mitral valve insufficiency or mitral valve disease in dogs. And what happens is those becomes warped. If you've ever lived in a house, an older house, close or it's hard to open. And so it's a thickening of the tissue of the leaflets. It's typically caused, like I said, by chronic infection due to bacteria coming from the mouth. We can diagnose with an ultrasound, which is echocardiogram. We usually treat them with diuretics, ACE inhibitors, positive inotropes, antihypertensives, and so a lot of different medications. Heartworm disease is something you should be somewhat familiar with. Heartworm disease is common in this area. It's common with dogs and cats, although it's underdiagnosed in cats because cats, we don't have a SNAP test for cats that is very reliable. So for dogs, we'll do antigen testing through an ELISA test or a SNAP test. For cats, if we get a positive heartworm SNAP test, that's unusual. Typically, if we suspect it, we want to do an echocardiograph. We may be able to see it on x-rays. We could do a blood test that is a heartworm antibody titer. But it doesn't necessarily, there's no really great test for cats. I have diagnosed it before on an echocardiograph. The treatment for dogs, we do have an adulticide therapy, which will kill the adult worms, but also we have the microfilariacide therapy, which is the monthly heartworm pill that you're used to, kills the baby worms. We typically don't do surgeries. That's a pretty difficult surgery, and it's not something that a general practitioner would attempt. Dogs, it's a difficult treatment. It takes months to treat, and during which time they have to be absolutely quiet. They have to be kept in a cage, outside walking to go potty and right back inside. No excitement, no heart racing. Treatment for cats is not often done. We can give them a microfilariacide, Revolution. We can treat them with an antibiotic that kills a bacteria that lives on the worm, and then we just have to wait for the adult worms to die, which takes about 2 years. Once the worms die, we have to look and see if the heart has been damaged, and often it has. Systemic hypertension can happen in dogs and cats. It's not as common as in people. If we see an increase at 180 millimeters of mercury in a calm patient, that is systemic hypertension. We need to treat that. Anything greater than 160 is suspicious. There are primary causes, there are secondary causes. Usually secondary causes are due to renal disease or cardiac disease. So we do have blood pressure cuffs for animals. We can do blood pressures just like we do for people. And we can look in the back of the eye. A fundic exam is a good way to look at small vessels in the back of the eye, and if they are engorged or enlarged, it can tell us that we may have systemic hypertension. Then we can measure that. So treatment would be antihypertensive medication. All right, moving on. So heart and lungs, it sounds really complicated. Definitely do some more reading on it. Try to associate some of the diseases with things that you're used to in your life or with your parents or your grandparents. That can help you understand a little bit better. GI tract, we see a lot of problems with the GI tract. Mostly it's diarrhea, but it is one of the big things that we see. So inflammation, irritation, obstructions. We have to be able to diagnose the symptoms, the conditions. We have to understand the difference between regurgitation and vomiting. Vomiting with blood, hematemesis. Regurgitation simply means they're bringing it up from their esophagus. It hasn't really gotten into their stomach yet. And then vomiting means that it's actually being brought up from their stomach or their upper GI, duodenum, upper intestinal system. There's a difference, and it's important to know the difference because there are certain diseases that go along with regurgitation versus vomiting. They're very, very different. Diarrhea, we need to be able to categorize the kind of diarrhea. So here is a normal, score 3 is a normal feces. 2 would also be somewhat normal, be a little bit less fluid. Number 1 would be constipation, very hard, a lot of effort. And number 7 would be watery with no texture. So you need to understand your scoring system in order to be able to really understand what's going on with the fecal, with the colon. And this is the colon is where all of the water is supposed to be absorbed back into the body, so we don't have dehydration. If it's not working really well, if things going through the colon too fast or the colon is too inflamed, we're going to get this. The fluid is within the feces. If the colon is absorbing too much water, we have dehydration, or the feces are staying in the colon too long. It's not moving things through the colon. We have constipation. It will get to number 1. So understanding those two things. Also, dogs almost never get constipated. If you see a dog or an animal or a person calls, a client calls to say that their dog is straining and they think it's constipated, 9.9 times out of 10 it is diarrhea. It's just not getting a whole lot out. Constipation almost never happens in dogs. Cats, less than 50% of the time is it constipation. Usually it's something else. But constipation happens more often in cats. It almost never happens in dogs. So I don't rule it out completely, but usually it's diarrhea. Hematochezia means blood in the stool. Fresh blood in the stool is not as worrying to me as digested blood. Digested blood is melena. Melena is when we have a black, tarry stool, and that means that we have bleeding further up in the GI tract. It's been partially digested and it's coming out with the stool. There's a lot of blood vessels in the colon, so if some of those burst, I'm not really as worried. It tends to bleed a lot. I'm not as worried about fresh blood in the stool as I'm worried about melena or dark tarry stool. Tenesmus means straining, and an animal with constipation or diarrhea can have straining. The pancreas and the liver are part of the GI tract. They help with digestion, so we do consider them part of the GI tract. Pancreatitis is a really common disease that we see with dogs, especially dogs that have been fed some extra treats around holidays when somebody thinks, oh, they would like the extra turkey or the whipped cream or the stuffing. So really high fatty foods, really, really high protein foods, or just foods they're not used to can cause the pancreas to overwork. And when the pancreas overworks, that means is it's overproducing digestive enzymes. And when it overproduces digestive enzymes, not all of them can make it through this little duct into the duodenum where they're supposed to do their work, and so they splash out onto the pancreas itself. Digestive enzymes on the pancreas will start to digest the pancreas, which will cause inflammation of the pancreas and eventual scarring of the pancreas. So if we have chronic cases of pancreatitis where the animal just gets logy after eating a big meal, or vomits, or gets really dehydrated after the holidays, happens again and again and again, that pancreas will eventually scar down, and it can lead to exocrine pancreatic insufficiency, meaning that it doesn't produce as much digestive enzymes, so food is not digested properly. Or it can cause diabetes mellitus, which is the pancreas is where insulin is formed and helps to break down glucose. And so animals with diabetes mellitus, we often see these in older dogs, a little bit overweight, that may have been eating human food for a long period of time. So I really struggle with people feeding human food to their pets, because it can lead to chronic pancreatitis and diabetes mellitus. Hepatobiliary disease, there are a lot of different forms because the liver is a very complicated organ. It can cause hepatic encephalopathy. Encephalopathy, if you break down the word, means disease within the brain. And if you add hepatic to it, it means it's because the liver is not pulling out the toxins from the bloodstream. So those toxins in the bloodstream are getting to the brain and causing some changes within the brain, some neurologic changes. So we can see seizures, or the pet can get really sleepy, or have some abnormal behaviors. So hepatic encephalopathy can be related to liver disease. We can also see feline hepatic lipidosis, which is when we have a cat that is overweight, that stops eating for whatever reason, and then their body goes into starvation mode, and it pulls the fat from their body into the liver, causing the liver to be full of fat and not able to function normally. And that's a pretty common disease of overweight, stressed overweight cats. Canine chronic hepatitis is an inflammatory disease of the liver. A lot of different causes for that. A portosystemic shunt, if you know what the liver does, it filters out toxins from the basically digestive tract, or byproducts of the system, and go through the liver in order to do that. And the blood flow has to go through the liver. The blood will shunt around the liver and not get filtered. And when we have that, then we get hepatic encephalopathy. A portosystemic shunt can be a large one, so a large vessel that goes around the liver, or it can be many, many, many small ones, so microhepatic shunts. And little dogs are pretty prone to hepatic shunts. Or portosystemic shunts. And then we also have feline cholangitis, which is an inflamed bile duct that can happen with cats, and that can cause a decrease in the bile into that comes from the liver with all those bad byproducts into the digestive tract. Urinary disease, chronic kidney disease. We can get a acute kidney disease or a chronic kidney disease, pretty common with cats as they age, to have some chronic kidney disease. And like I said, it's often due to dental disease. Can be non-azotemic, mild renal azotemia, moderate renal azotemia, or severe renal azotemia. So what is azotemia? With a normal kidney, the kidney filters out toxins, just like the liver does, but it does it from the bloodstream. And it takes actually toxins that the liver has filtered out and then filters those out through the urinary system. So it takes different toxins, one of which is called blood urea nitrogen. Blood urea nitrogen are things that are made from the proteins that the blood or liver has filtered out certain proteins, turns it into blood urea nitrogen, which is filtered out through the kidney into the urine. Should be. If it's not functioning normally, then that blood urea nitrogen that is made in the liver will actually not be filtered out from the kidney, from the blood in the kidney, and will start traveling around the system. So we call that azotemia. It's azo, it's the blood urea nitrogen, the nitrogen in the blood. So increased BUN, blood urea nitrogen, in the bloodstream is called azotemia. We can have kidney disease without azotemia. So, and the thing is that it takes, in order to see increase in blood urea nitrogen, it takes 50% loss of kidney function, which means an entire kidney has to be not functioning before we will see azotemia, which is kind of too late, right? So if we have complete loss of a whole kidney before we will see azotemia, by the time we're seeing severe renal azotemia, it can be, we're looking at a very short time span of treatment. We can do a renal transplantation. That is rare, but it's being done in Michigan. If you have a cat that needs a renal transplantation and you use a cat that is a donor cat, then Michigan, University of Michigan, where they have the vet school there, they require you to adopt the other cat, the donor cat as well. So it's a kind of a win-win for everybody. We can function with one kidney. But we need to make sure that kidney stays healthy. We can use palliative treatment. There is no cure for chronic kidney disease, so palliative means we keep them comfortable, and that's the most common thing. So what we do is we just slow the progression by correcting imbalances. So the normal kidney is going to filter out a lot of different things, and it's going to maintain blood pressure, and it's going to maintain electrolytes, etc. If it's not doing its job, then we have to do it from the outside. So giving fluids, putting them on a low sodium diet. There are certain kidney diets. Hills makes a KD kidney diet. Royal Canin makes a kidney diet, a renal diet as well. Using those diets has shown to prolong life of an animal with chronic kidney disease anywhere from 2 to 4 years. So just diet alone can make a big difference. So urinary disease doesn't, there's the bladder as well. And which is stones. It starts with little crystals. Crystals gather together. If you've ever made rock candy, you know that if you get a really strong solution of sugar and you put a string in it, the crystals will form on the string, and eventually those crystals will gather more crystals, and you pull out the string and you have a big thing of rock candy. That's kind of how stones are formed in the urine. What we have is an accumulation of minerals, and like sugars, but in this case it would be magnesium or phosphate or calcium oxalate, and those tend to accumulate. The crystals tend to accumulate, and then if we have a decreased urine flow, we have a concentration of the urine, and then we have a concentration of those minerals. They will form into crystals, and those crystals will come together a little bit more frequently and then formed into stones. It is less common to see stones in cats than in dogs. When we see blocked cats, it's more often that the cats are blocked with mucus than with stones. And when we do see blocked cats, it's almost always a male. Probably 99.99% of the time it's a male, because they have smaller urethras exiting their bladder. Bacterial cystitis is not as common in cats as in dogs. We'll see lower urinary tract infections or UTIs, more so in dogs than in cats. With cats, they tend to get an idiopathic, so we don't know what causes it, cystitis. So they get an inflamed bladder. Or we also call this feline lower urinary tract disease. We're not sure really what the cause of this is. It could be genetic. There are a lot of studies happening at Ohio State University and Cornell trying to determine the cause of this. We also see this as a symptom of stress as well. So a cat that is stressed, that starts urinating everywhere, doesn't typically have a urinary tract infection, has what we call feline idiopathic cystitis, and we have to calm the inflammation down as well as calm the cat down, make sure that they're not stressed. Endocrine disease. Pretty common to see in dogs and cats. Endocrine system is a really important part of your body it releases hormones, and it works in conjunction with your neurologic system to keep everything kind of status quo, homeostatic in your body. Hyperthyroidism is common in cats. It causes a fair amount of secondary disorders. Your thyroid is in charge of your metabolism. So if it's increased with hyperthyroidism, they're going to eat a lot, and their metabolism is going to be so fast that their body is just going to waste away. No matter how fast they eat, their metabolism is so high that they can't keep up with it. So their organs start to fail. They start to get basically digested. They lose a lot of muscle mass. We'll see a lot of problems with cardiomyopathy, systemic hypertension. And then, and this doesn't happen because of hyperthyroidism, but often along with hyperthyroidism, we see chronic kidney disease. And the problem is that because the metabolism is increased and the blood flow is increased with cats with hyperthyroidism, it actually masks chronic kidney disease. So when we're treating the hyperthyroidism, we're making the hyperthyroidism better, we're actually killing the cat with kidney disease because we're making the kidney disease worse. So anytime we start to treat hyperthyroidism cats, we have to do blood tests to make sure that the kidneys are still functioning normally. How do we treat hyperthyroidism? We used to do a lot of surgery, but there's a lot of side effects with the surgery. Actually, the best way to do it is with radioactive iodine. If you give an animal iodine, the first place it's going to go to is the thyroid gland. The thyroid gland collects iodine. If you give an animal too much iodine, it will actually cause hyperthyroidism. It'll cause an increase in the thyroid gland. But if you give the animal iodine that has radioactive particles associated with it, it will kill the thyroid tissue. So it'll accumulate in that thyroid tissue and then kill those cells. But it's very selective. It'll just kill those thyroid cells. So we'll kill those thyroid cells that are actively collecting the iodine. But we'll leave some thyroid cells that aren't actively collecting the iodine. We'll leave the parathyroid, which is a little gland that sits on the thyroid that we might alone. So we don't have to worry about damage to the parathyroid gland. We don't have to worry about damage when we do surgery. So it can be really effective treatment. Animal does need to be hospitalized for that treatment because obviously it's a radioactive material. It needs to be handled very carefully. We can also use palliative antithyroid medication. It's typically medication has to be given once or twice a day. If you've ever pilled an angry cat before, and a lot of times because of this increase in metabolism, these cats get somewhat aggressive. It can be a difficult thing to do. So, but we do like to start with a medication if we can. And they do make medication that you can put on the ear that's a transdermal medication, just because we want to watch that kidney to make sure we're doing okay. One other treatment that I don't have here listed in this lecture, that's why it's important that you're listening to it. So write this down. There is a new food, it's not new, it's been out for a couple of years now, called Hills YD. And Hills YD, if it's the only food that these cats eat, will actually treat the hyperthyroidism. It's a low iodine food, and will actually make the kidney disease, if they have it, better. So it can really prolong the cat's life, but they can only eat that food. They can't have any other treats. They have to eat just that food. All right, so that's hyperthyroidism in cats. Hypothyroidism we only see with dogs. And dogs with hypothyroidism have a decreased metabolism, which means they're going to be overweight. They're not going to be able to regulate their body temperature, so they'll be cold a lot of the time. Their hair won't grow normally. So they'll have balding spots, and they'll have a really rough hair coat, and then they'll start to get some skin problems. And a lot of times these skin problems turn into hyperpigmentation, or they'll have a darkened skin because the skin cells are just not turning over rapidly enough. It's not healing rapidly enough. So we get this balding, rough-coated, overweight, and a lot of times these are retrievers. This is very genetic, and we don't know why the thyroid stops functioning in these dogs, but for some reason that thyroid gland is kind of turned off. A couple more endocrine diseases. Diabetes mellitus. There's type 1, which means the pancreas is not making enough insulin. Type 2 is when we have insulin resistance. So type 2, the body is not detecting or responding to insulin appropriately. With a healthy pancreas, the pancreas produces insulin, which gathers the glucose, and the glucose is put into cells so that the cells can function normally. If you don't have your pancreas functioning normally, the immune cells are destroying the beta cells in the pancreas. The pancreas cannot produce insulin, and so there's more glucose in the blood, not enough in the body tissues. So more glucose in the blood means more glucose in the urine as well. So we'll get urinary tract infections, we'll get skin infections, the tissues are not getting energy. It's just a bad thing. So this is type 1, and it's an immune-mediated disease. So the immune cells are not functioning normally. Type 2 is often due to the fact that the pancreas is producing less insulin. It's not functioning normally, and remember what I said, the problem with that is we usually see this in dogs that have been fed inappropriate foods, too much inappropriate foods, so there tend to be overweight dogs that are table fed. So caused by chronic pancreatitis or some sort of disease that causes the pancreas to produce less insulin. And so this is a different way that we see this. So type 1, type 2 insulin, diabetes mellitus. Two other diseases. Now, these two diseases do confuse people, and we have to remember with endocrine diseases, there's often it's all about biofeedback, so it can be either high or low, okay, as far as the hormone that it's putting out. So the best way to describe this is through hyperthyroidism and hypothyroidism. So hyperthyroidism cats, increased metabolism. Hypothyroidism dogs, decreased metabolism. And if you treat one, you have to watch for the opposite reaction to occur. So if I'm treating hypothyroidism dogs and I give them too much thyroid hormone, because we can just supplement the thyroid hormone with these guys, I can turn it into hyperthyroidism. So it's all about balance. Okay. Hyperadrenocorticism is also called Cushing's disease, and we see this in dogs. This is what it looks like. A little white dog. I don't know why they're always white, but it tends to be a little white dog. Hair loss, just like with this other hypothyroidism. A big belly, but this belly is big because the muscles in the abdomen are weak. It's not because necessarily the dog is overweight. An increase in the adrenal gland, think about increase in adrenaline, meaning this dog is under stress, the body is under stress all the time. So I don't know if you've ever been under stress, like in this class, because you have to get all your work done. But if you're under stress for a long period of time, every day, day in and day out, you're going to see some changes in your body. Your abdomen is not going to be as flat. Your hair is going to start to fall out. these are the kind of things that we see with a hyperadrenocorticism. Hypoadrenocorticism, on the other hand, this is the opposite, is called Addison's disease. We usually see these in middle-aged dogs. Let me say that hyperadrenocorticism is caused by a tumor either in the pituitary gland in the brain that tells the adrenal gland what to do, or in the adrenal gland itself. It's usually in the brain. If it's in the adrenal gland itself, we can remove it. If it's in the brain, we typically can't. We just have to medicate them. So tumor, think tumor. Hypoadrenocorticism is an insufficient amount of stress hormone. So we all need stress in our life. Believe it or not, it's not good to go through life with no stress. You need a little bit of stress to get you through your life, okay? So hypoadrenocorticism is no stress. And the dogs will come in completely lethargic, and this is a critical patient. This patient with a lot of stress can actually live for a fair amount of time. They're not going to look pretty, but they're going to live for a fair amount of time before it actually kills them. This patient with no stress hormone, cannot maintain their body functions without it. So this pet needs to be treated with fluids because it changes their electrolytes. It makes them crash, they'll vomit, lethargy, be really tired, just look really sick. It'll kill their kidneys. So we need to put them on fluids. We need to supplement their mineralocorticoid, which is what is missing. And we also need to give them some steroids, which is basically what we're seeing a lot of, too much of with this pet. So 3 different endocrine diseases, fairly common, especially diabetes mellitus, not these 2 as much, although I'm seeing a lot more Addison's than we used to. The immune system is really important for a lot of different reasons. It's good to have a healthy immune system to fight diseases, but also to maintain your red blood cells and to maintain your whole body function. So a couple of immune-mediated diseases you might see: immune-mediated hemolytic anemia. If your immune system is not functioning normally, it's recognizing its own body cells as dangerous invaders, then it's going to kill those normal body cells. So immune-mediated hemolytic anemia, IMHA. There's also immune-mediated thrombolytic anemia, which is IMTP, which kills platelets. This one kills red blood cells. Your own body killing your own red blood cells, not cool. If they're killing their own platelets, also not cool. So if you have no red blood cells because your body is destroying them, you have to figure out a way to decrease the immune response to your red blood cells. Same with if they're killing the platelets, you can't clot as well. You're going to have bruising, bleeding throughout the body. So those are 2 pretty serious diseases caused by the animal's own immune system. Also acquired myasthenia gravis. We're not sure how they acquire it, think through viruses, but pretty commonly seen in labs and German Shepherds. What happens is their muscles, they'll walk fine for about 2 seconds, 3 seconds, and then all of a sudden have to sit down because they get very, very weak. What happens is there's no breakdown of acetylcholine, which helps their muscles to fire again and again and again. And so when that can't fire again and again and again, it just stays in a steady state and weakens the muscles. So myasthenia gravis can be seen in young to middle-aged dogs, causing weakness of all the muscles. We usually see it start with the esophagus, which is a thin muscle, and what happens is it dilates, or and so they regurgitate. So we talked about regurgitation and certain things being associated with it. It's megaesophagus, increased esophagus. If the animal is not able to, the esophagus is not able to compress the food and move it down to the stomach, then it will just sit in the esophagus and they will just regurgitate out a tube of food. And the problem with that is that if they're doing that frequently enough, at some point they're going to try to breathe while they're regurgitating. They're going to aspirate that into their lungs, and then we get an aspiration pneumonia, and that's what tends to kill them. So this myasthenia gravis starts with the megaesophagus. We usually see that first, and it progresses usually to the skeletal muscles. All right, infectious disease. There are a lot of things in the environment that are pathogenic. When we have a normal immune system, normal skin, normally functioning respiratory tract, infectious disease doesn't hurt us very much. But there are viruses, bacteria, fungi, and rickettsia, which are kind of like bacteria, but they're one-celled organisms that try to get into our system. That's what their job is. These can be transmissible, which means we can give them from one animal to another, or they can be non-transmissible. Non-transmissible means that they are just associated in the environment. Transmission, we have to have a pathogen with a reservoir. Where's that pathogen hiding? Okay, where's this big source of pathogen? So if you've ever had a really bad cold versus a mild cold, it all has to do with how big of a reservoir you came into contact with. Somebody sneezes into your face, typically you're going to be exposed to a lot of virus, right? Because it's all coming right at you, and you're going to inhale all that in. If somebody sneezes, wipes their nose, and then puts their hand down on a surface, and you come by and brush by that surface and then touch your own nose, you're going to have a mild case because you're only going to come in contact with a small amount of infection, okay? So whatever the size of that reservoir and how pathogenic or how invasive those microorganisms are will determine how sick that pet can get. Portal of exit, how does that pathogen get out of the infected animal to the animal it needs to infect? The mode of transmission, the portal of entry, the route of infection, those are all important in knowing how sick that animal is going to get. Is the transmission direct between animals, or is it indirect through what we call contaminated fomites? Fomites are like articles of clothing, food bowls, your shoes, boots, things that animals can come into contact with that transfer these pathogens versus direct animal-to-animal contact. That's why it's important to do proper cleaning in the hospital environment. So steps of infection. First, we have a pathogen. So for instance, maybe parvovirus. Then we have a reservoir. That means that we have the parvovirus is living in an infected puppy. The portal of exit is how does this parvovirus get out of the animal? Is it feces, urine, saliva, respiratory, ocular secretions, hair, blood? So in parvovirus, it comes out through the feces. And then mode of transmission. With parvovirus, it's direct. So an animal sniffs another animal's rear end, sniffs where the feces is or was. That's how they become infected. Portal of entry. How does the animal get parvovirus? They lick their nose, and the virus gets into their digestive tract. And who's the susceptible host? An unvaccinated puppy or an immunosuppressed adult? These are the things that we have to think about. I mean, if you think about the coronavirus, when you first come across a new virus, you have to think about, okay, what's the pathogen? Okay, why are these people getting sick? It looks like a virus. Okay, it's a virus. Where did it come from? What is the reservoir? How does it get out of the person? Oh, they're coughing. Okay, that's got to be a portal of exit. How does it transmit to the next person? We didn't know that for a long period of time. We didn't know, is it respiratory? Is it on surfaces? And so that's why we were getting different information. People weren't lying to us, folks. They were figuring things out. And we were seeing science happen in real time in the media. And so obviously there are going to be mistakes made and assumptions and theories that are being proven incorrect and theories that are being proven correct. And so how do we get coronavirus? We inhale it in. And who's susceptible? Who's most susceptible? We're still figuring that out. So these are things that are in your life right now, really important. In animals' lives, really important. But substitute parvovirus for Bordetella. How do they get Bordetella? Bordetella is a bacterial infection, kennel cough. But kennel cough isn't just infection. There's also a viral component. There's an environmental component. So it's a combination of a number of different things. You start adding those different things in, it becomes a lot more complicated. Who's your reservoir? It's an infected animal. How do they get it? They cough or bark at something. You don't even have to cough. With coronavirus, you can just be yelling at somebody and those viral particles will get to somebody else. Mode of transmission. How does it get in? It's right there at the nose. And that's where we try to put the immune response is a nasal vaccine. So we put it right at that port of entry. So these are things that we think about as we talk about infection. Infectious diseases, zoonoses are transmitted directly from animals to humans. These are shared vector zoonoses, or we can have reverse zoonoses. So reverse zoonoses would be we give it to animals. We can give ferrets the flu. Animals can give us the flu. We can give ferrets streptococcus infections as well. So, I mean, those are some examples. Shared vector zoonoses would be, a vector is something that is a reservoir for diseases. I think of children as vector. I have kids. I love my kids. I love kids in general, but they are little vectors of diseases. And if you're a parent that has a kid in school or in a daycare, you know that. Ticks are vectors of diseases. Mosquitoes are vectors of diseases. And if, Lyme disease is a shared vector zoonosis. We don't get it directly from animals. We get it from a tick, and animals can get it from a tick as well. So those are different infectious diseases and different ways that we have zoonoses. The Centers for Disease Control and Prevention helps us to understand that. So it's a really good site to go to if you're trying to understand certain diseases. Controlling infectious diseases, it involves interrupting the process of infection. So first, we could kill the pathogen in the host or inanimate reservoir. We can use antibiotics, antivirals, antiparasitics. We could, and you've heard of, with the coronavirus, you've heard of people trying all sorts of different methods of trying to kill the pathogen in the host or inanimate reservoir. We haven't had any one great thing work, but there are a lot of different things that seem to be working on different people. And again, you're right in the middle of this science unfolding before your eyes. There are going to be mistakes made. We could kill the pathogen on a fomite. That's why we use sanitation, disinfection, sterilization. We could kill the pathogen in or on a vector. So if we have a vector that we can kill, we could use a preventive antiparasitic medication, environmental pesticides, soap and water, just different things that we can use to kill something on or in a vector. So wash your hands, right? Strengthen host defense system. So vaccination, that's what we're looking for with the coronavirus, maintaining proper health and nutrition, and then finally decrease host exposure. So why are we talking about this, masks and social distance with coronavirus? Because we need to decrease the host exposure, and that's the simplest way to do it, and that's why it's really hard for some people to really understand it. I think is that it seems too simple. They want a shot, or they want a cure for coronavirus that's a little bit more. It makes a little bit more sense to them on a medical level. But basically, if we stay away from each other and we wear a mask, we have a much more increased chance of controlling infectious diseases. So here's one way to control it. We have isolation wards. There are very, very specific policies and procedures when you're dealing with isolation wards, and if you're in a hospital, you need to pay very specific attention to those. So anytime we have a patient with a potentially contagious disease, whether it's parvovirus, which is most common, or kennel cough, which is also common, we're going to want to not keep them in the same area as healthy animals. Or sick animals, or otherwise sick animals. We want to put them directly into this isolation ward. If we are discharging the animal to at-home care, we want to go directly to at-home care. We don't want to go into a treatment area. Any critical cases, we're just going to admit them directly to isolation ward. We'll come back and talk to the owner later. Anything surface that animal has touched in the hospital has to be isolated in and of itself. It needs to be sterile, disinfected. We typically would have a room. If we had a parvo puppy in it, that room would not be used by immunosuppressed animals or dogs really for several days. Even though it's been properly disinfected, we would just keep that free from use from dogs that could be infected. Nursing care. Patients with infectious diseases require extensive nursing care and support. And obviously, if you have an animal with infectious diseases and you're the person taking care of them, then often you're not taking care of other healthy animals. So it can be really nurse for the day. We always, when we have that really sick patient, we have to also monitor for secondary infections, secondary symptoms. You, as a veterinary technician, are critical in the role of educating and supporting the owner of the pet with a transmissible infectious disease. If you have an animal with parvovirus, you have a puppy with parvovirus, it is your responsibility to let the owner know that if that pet dies from parvovirus, they cannot go out and get another puppy. They have to wait 6 months before they can put another puppy in their home, because that virus, we think it lasts for a long period of time in certain things in the home. So just to be on the safe side, we usually say 6 months. All right, so if you have any questions, please bring them to class. That's what we have for class today. And look forward to hearing your critically thought out questions, and certainly look through your book, especially those technical evaluations. I really want you to understand those and use those in your everyday practice.